Yeah, I don't see anything wrong with having a person in charge of it. I think the emergency manager should probably take control of it. I think it needs to be coordinated through anybody else that has any responsibility to it. But I definitely think that Art should be the one taking care of it.
So my suggestion then right now is, so this is clear and on the record, I would like to ask for a vote of the commissioners that would basically place the responsibility for our emergency trailer under our emergency management officer.
And I would make that motion.
Okay, we have a motion. Second?
Second.
All in favor? Aye.
Aye.
Okay. Art, does that satisfy what you were requesting?
Yes, sir.
Okay. Art, I do have a question for you. You and
Yes,
I
sir.
talked briefly about what I perceived as discrepancy in the daily report coming out on COVID cases. The numbers simply don't add up. There's obviously a mistake in there somewhere. You indicated to me that some emergency managers also noticed that. Do you have any comments on that at this point or thoughts?
No, sir. Yesterday, during our meeting, we had a more pressing issue that we had to discuss, and due to the time frame and scheduling, that did not come back up. I was on the LPHA call this morning. I brought it to their attention as to what you and I had discussed as far as, who's off and who's on and all of that. The reply I got was they are looking into it. They are blaming it on the state. And so I'm trying to get clarification through Lillian Cole, the epidemiologist for the Valley. And as soon as I get that, I will forward you the solution or the answer.
Okay, thank you. For those of you that don't know what I'm talking about, if you notice in our daily health reports coming from our daily COVID reports coming from our public health office, it said yesterday, I believe it was, day before, we had a cumulative total in the valley of 456 cases, and they also showed that 456 had completed isolation. Obviously, that's a mistake. Otherwise, that would mean that we had no cases, active cases in the valley. My concern is when we get that kind of information, we can't make coherent decisions or even ascertain what's going on. And it's a clear mathematical error, but I'm wondering if it isn't caused by process error. And it would seem to me that our local public health office could give us more accurate information as to how many cases we actually have active, how many we have in the hospital, and how many of the counties have recovered. Because otherwise, it's just useless information.
All right. Mayo, take question. You guys say goodbye.
Those are my comments. Does anybody else notice that?
Yes. Give me a minute.
I did notice that, John. I told you before, I picked that number up pretty quick, and I thought that's pretty good. We were 100% cured. Now we can go wide open because that's what it looked like to me. So.
Yeah, except over the other column, it shows active cases. It just doesn't make sense.
Yeah. And if you read the first column, you can make a lot of different decisions than you can if you read the whole chart. So
that's right. And I call that attention to detail on the people who produce the reports or who vet them for us before they come before us, before they're reported to us. Otherwise, it's basically unusable at the way it's being presented right now. But Art, you say that may be coming up in conversation?
Yes, sir. No, it not may. I will ensure that it comes up in conversation.
Thank you. Do we have anything more for Art?
I don't.
Thank you for your updates.
Thank you, Art. Thank you for coming.
Have a good day, folks.
Thank you. We'll see you. Next on the item list is the coroner, and we have the funeral bids for the indigent citizen, and we need approval of a resolution to bury the indigent citizen. Trish, have we gotten a copy of a resolution from the attorney yet?
I have not.
Okay, so we won't be able to approve that until he presents it, but we can the coroner can give us his recommendation and the report on the bids.
So I'm the one that received the bids. I'll be happy to go over that. And I want to clarify this morning, one of the funeral homes did resubmit. I pointed out to them that they neglected to include the transportation to the funeral home. So you should have that on your email. Romero, 3 funeral homes responded. We have Romero, who came in at $6,384.30. Rogers, who came in at $4,310, and Strohmeyer, who came in at $4,045 even. So the lowest bid would be from Strohmeyer.
And my question was directed at the coroner. Would the coroner give us his insight on this? Are the bids comparable? As the coroner, you have an idea of what services are required for these things?
Yeah, John, I'll be honest, due to my conflict of interest, I didn't review them. We had them all sent directly to Trish. And just because of my.
Oh, you muted yourself, Stephen.
Unmute Steve if you can.
You're still muted.
He's still talking too.
Okay.
Here we
I
go.
think as far as things are concerned, I did have a few questions. I think we got some clarifications amongst the funeral homes. So I think they should all be relevant.
Okay, and for future reference, because of your inherent conflict of interest, are we going to have the administrator do the review on all these bids?
That's kind of what we've done in the past, yes.
Well, this has only happened twice now.
Yeah, but we did it with the transportation bid too. When I first took office, I had no part of making that contractual agreement either. I stayed out of it, and that was handled by administration and the commissioners.
Okay, since the administrators probably not familiar with all the details, one of the questions I had was, are they bidding the same product and the same service?
Yeah, I think Trish's letter was pretty descriptive as far as what we were requesting. So I think it should be the same product as far as I'm concerned.
Okay. Then the other question I had, in this specific instance, I understand that the internment will take place in Colorado Springs.
Correct.
At the Veterans Cemetery there, or the
Yes.
National Cemetery. That's a hard one to predict, and going forward in because of transportation.
Yes.
How do we standardize this when we're doing indigent burials?
Well, and again, John, Commissioner, each case is going to be different. You know, whether they're it's hard to standardize something that can be so different. If they're veterans, they're eligible for different things. If they're if they're indigents, non-veteran, they're eligible for different things. It's hard to kind of standardize what we're trying to accomplish, because each case, as we review it, as we try and find next of kin, those kind of things, it's all going to be different.
Okay, but perhaps I'm overly dense on this. It would seem to me that the main variable when we're talking veterans is what percentage of that cost is eligible for reimbursement to the county.
Okay.
Would that be correct?
Yeah, sure. Yes, that could be. You bet.
Okay. So that doesn't really affect the cost of the actual caring for the body and burial then. It's just a matter of how does the county get reimbursed if eligible? Correct.
That's correct. And so that's something that, as the coroner, once I get a hold of an invoice, I can go ahead and submit that to the VA through Senator Gardner's office on this specific case. But I'll go ahead and submit that to the VA for their process of reimbursement.
Right. But the county's obligation is to see to it that the body is properly cared for and interred. So the variables would be, in terms of actual cost for bidding purposes, would be things like cost of transport, cremations, however the body is cared for. As I understand, in the indigent burials, cremation is not an option under state law at this point. Is that correct?
That is correct. Yes, they've got to be
Okay.
buried in a recoverable manner.
So the casket and the body in a recoverable manner, those are something that any funeral home could bid outright and just say that's what we're going to charge for those services.
That's correct. Yes.
Okay. And the difference would be whether or not the cemetery of choice requires a vault.
Correct.
Okay. And then the other one variable would be, do we have to transport that body, say, to Colorado Springs for burial in a national cemetery? Otherwise, it would be buried locally.
That's correct. Yes.
So in coming up with if we would do a master bid, which we've talked about, so we don't have to go through this every time, it would seem to me that the casket, the preparation of the body and care for the body could be bid. The cost of the plot may not be, that may be a variable depending on whether or not Del Norte, Monte Vista, wherever.
Sure.
And we may want to consider negotiating with the cemetery for that. Because as I understand, once the body is in the county's care, all preferences basically are set aside and the county does what they want. So we have the casket, which anybody could bid.
Yep.
We have the care of the body, which anybody could bid. The variable then would be transportation.
Correct. Yes.
And I would assume that they could do a per mile bid on that.
Correct. Yes, sir.
So that one is taken care of. Is there anything else out there that we need to consider if we do a master bid?
We might ask for storage, keeping of the body, so refrigeration.
Okay, right.
That would be something that might be pertinent. Let's see, you've got professional services, you've got the removal, you've got the use of a utility vehicle or a hearse, something to deliver that body to the cemetery. I think we've already kind of talked about that, but that one, mileage may be included, or there may just be a set fee for the use of the vehicle. So we might ask for the use of a hearse or use of a utility vehicle, and maybe include that in the bid as well, because like most funeral homes are going to charge for the use of the hearse or utility vehicle, and then mileage on top of that. That's how the billing traditionally works in a funeral home.
Sure.
So we might ask the hearse or a utility vehicle, and then mileage.
So if I hear you correctly, almost every item here could be bid. The variables would be, for instance, how long the body is held in storage, but that could be a per day charge.
Yes. Correct.
And then the professional services would be probably pretty standard for any of them.
Correct.
Okay,
That's
they
a
could bid
standard
that.
overhead fee.
Transportation, perhaps per mile charge, and they could factor in whatever vehicle they use for that purpose.
Yeah, it's usually a separate line item on a funeral contract. So I would ask for the use of the hearse or utility vehicle, and then mileage per mile.
Okay. We have discussed the idea of doing an annual or a longer term bid rather than handling these on a case by case.
Correct.
I don't know if the commissioners want to act on that now, but maybe, Steve, if you could prepare a formal recommendation to the board as coroner.
Okay.
And having thought through these different charges that are customary and ordinary, I'm getting seasick.
Sorry.
that are customary and ordinary, and then if regardless of what reimbursement or assets are available to the decedent, the county is still going to have to pay for these services and then attempt to recover whatever they can from whatever sources available.
Correct.
Now, I have one more question. If a decedent dies and has some money, or already has a grave plot purchased,
Mm-hmm.
Okay, and that came up in this particular case. Is there, that is a variable that's a little hard to predict and accommodate.
It is, depending upon the resources available by the person themselves, and the requirements of the cemetery. And in this specific case, we ran into the fact that Home Lake required a vault, which the person did not have enough money to cover. That would have been out of the pocket of the county, and in the county's best interest, it was less expensive for us to bury in a VA cemetery where the vault is provided by the government, as well as the opening, closing of the grave, the plot itself. Those are all things that are provided by the VA in a national cemetery, but not in a state-owned cemetery, which is Home Lake.
Okay, but in theory, if the Monte Vista Cemetery had donated a plot and the opening and closing, that might have been a less expensive option even than going to the VA cemetery, right?
It very well could have been, yes, that's correct.
Okay.
Could have been a little bit less expensive. You know, I'm just trying to honor him as a veteran at the same time. So it's a balance. You know, it is a balance.
Okay. Do the other commissioners have any questions or comments on this?
I
No.
don't, I'm good for now.
Would the commissioners entertain a recommendation from the coroner as to how we come up with a standard practice going forward?
Well, I think it's fairly clear what we're looking for and what he thinks is appropriate. And so I think that would be a good idea to act on it.
Okay, and have what I was asking is, well, I guess what I've seen so far in the two that we've done is they're kind of handled on an ad hoc basis simply because we haven't had a procedure. We haven't had this issue for a decade or so.
Yeah.
Would you be comfortable asking the coroner to come up with his recommendation on how we proceed forward? We're all a lot more educated on what it takes to bury somebody now. At least I am. Are you comfortable with that, asking the coroner to do that for us?
Yes, I am.
Okay, Suzanne? I didn't know if that was a yes earlier or not.
Yes.
Okay. Steve, is it clear to you what we're asking for?
Yeah, I think so. Yes, it is. So I'll put together kind of an idea as far as what we would expect to break down those charges, and give us an idea of a good estimate from local funeral homes to kind of put that bid in place, when we get there.
Okay, and beyond the bid, just kind of a how-to guide on how we should be handling this. And I know that the timing, the storage is a variable in part because you can't do anything until you've gone through the research process and done your due diligence on locating heirs or relatives. And there's maybe some other questions. But some of the stuff that held us up on the first one was the VA eligibility.
Yes.
On the but that's quite frankly kind of a non-issue because we're going to have to deal with this regardless.
Correct.
And so then the VA is just a matter of you or whomever attempting to collect whatever is eligible from those sources.
That's correct. That's correct.
Okay. If you don't mind doing that, do you have an idea how soon you could have that recommendation to us?
I can probably work on it yet today, maybe get it to you by the end of the week at the latest.
End of week. That would be great. Thank you.
Yeah.
Okay. Does anybody have anything else? We don't have the resolution yet before us. I don't know if Ryan's recommendation is that we have that before we proceed. Do you know, Trish?
So I do know that on the last one, a resolution was not prepared right away. That was the suggestion of the county clerk. So therefore, I would think that you could vote on these three bids and prepare the documentation after the point.
Okay.
That is what happened last time.
Okay. And so right now is with the correction that you made with the one bid, Which one is the lowest cost?
The lowest one would be Strohmeyer at $4,045.
Okay,
It matches 100% to the other two, with the exception of Romero. And here comes Ryan now, so if you want to pause. Romero would not send me an itemized list. Even though I did ask for it, they gave me the total price, but they are well above the other two anyway.
okay. So the one funeral home did not provide the information that you requested for the purposes of the bid. Is that correct?
Not an itemized version, just a cost, correct?
Right. Did you request it itemized, I assume?
I did,
Okay, and they didn't provide that.
correct.
Okay, thank you. Then I'll entertain a motion on the acceptance of the bid for the lowest cost bid on this indigent burial.
I would move that we approve the lowest cost bid, which would be Strohmeyer's at $115 less than Rogers.
Okay, we have a motion. Second?
Second.
Okay, motion and a second to accept the lowest bid for this indigent burial. Any other discussion or objections? Hearing none, motion carries. Is Ryan on now?
I am
He
on.
is.
Okay, Ryan, the question we had was, could we go ahead and proceed with this indigent burial without the resolution in place?
Yes,
Okay,
that's the simple answer. Again, I'm not, the previous practice had not been to prepare a resolution. I think it makes sense, but I think you can make those arrangements with the board's direction. My recollection is that the board had previously given that direction to the coroner to make those arrangements. I will prepare the resolution for signature that formalizes the vote of the commissioners.
thank you. And for the coroner, are you comfortable that you can proceed now?
Yes, that sounds good.
Okay, and that Strohmeyer's will then take custody of the body and make all the arrangements.
Correct.
Okay, thank you. Anything else for us?
I do. I don't know if this is the time. I needed to check with you guys. We did get my truck in, so I've got the truck. I am working on getting you some bids on the topper for the truck for transportation for autopsy. However, I wanted to see, we had initially talked during the budget hearing about putting on one or two people that we would pay through the county to be able to do the transporting for us, as opposed to doing that through the funeral home that we've contracted with. So I guess what I need to know is what my next step is. Now that we've got the truck, we'll work on the topper. Once we have the topper on, we're able to do our own transports at that point in time and not involve the funeral homes. But what do I need to do to be able to add those two people to my budget in lieu of the transportation that we have set aside already?
The first question always is, how much is it going to cost?
Okay, sure. And we have a transportation budget set aside that we pay to Rogers, who's the contracted party at this point, for transportation. And so my understanding during the budget discussion was that when we discontinued the use of Rogers as our transportation company, we would then go ahead and just utilize the funds that were left in that to pay the person that would be driving for us, because it's going to be a lesser cost. I don't know if I understood correctly or not.
Trish, speak up.
Yes, thank you. So I would like to just clarify that, so what those funds would be on an accounts payable contracted position, where what Stephen's talking about using a county vehicle would increase his salary line item. So what he would need approval, even if it was discussed before, would be approval to increase above what's been budgeted on the salary. Now, of course, it would cancel out if there's money in transportation and then the salary, but to make the commissioners aware, and commissioners do approve the number of employees. So that's what we would be looking for today, even if it's a zero extra cost.
And those would be part-time employees.
Correct.
That's my understanding.
And when does our contract with Rogers expire for transportation?
It didn't have an end date on it when it was set up. So it's not something that's got an end date. It's just as soon as we get the vehicle in a fashion where it's up and running, then we'll be able to get things done and cancel that contract and move on to our own transportation.
So it'd be basically moving money from transportation, or a portion of the money from transportation to salaries line item?
Correct.
Trish? Yeah, okay.
We wouldn't be moving. So at the end of the year, what you will be seeing is a number over and beyond what was budgeted in salary, but yet under in transportation,
And we would take care of that through the supplemental budget process?
if necessary. It's the final numbers that count. So if he overextends, we would need to do a supplemental.
Okay, I see. So is that something commissioners like to take action on right now and put this to bed?
I would like to approve, I'd make a motion that we approve his request to add people in exchange for providing transportation through the contract with Rogers. Was that a clear statement?
Second.
Okay, we've got a second whether it was clear or not. To restate for the record, the coroner has requested that the coroner's office, provide the transportation that is currently being provided under contract with a funeral home, and that he will have employees, he will hire employees, if he doesn't have them already, to be available for that transportation in the county coroner's vehicle. And so that's essentially the motion at this point. Then, unless there's an emergency, I assume, coroner, that we would not require the services of a funeral home for the basic transportation needs.
That's correct.
But, and this is a discussion clarification item. When we talk transportation, you're talking about the initial transportation of the body, or are you talking about transportation to the VA cemetery?
Right now we're talking about just the strict purpose of transporting from, here to El Paso County for autopsies and then returning bodies back home following the autopsy. That's the only transportation we're discussing at this point.
Okay, so whenever a body is picked up at the place of death, would the coroner's office be doing that also? Yeah,
we already have been. Yes, that's correct. We have been, unless it's these circumstances where it's a nursing home that contacts a funeral home, we do all the removals from places of passing. If a loved one dies in their home or in a motor vehicle accident or anything like that, we do all those transports already ourselves. This is strictly just more for transportation to and from autopsies, those kind of things to keep the two offices separate.
Okay, the question about the nursing home transportation and all, does that complicate this if the nursing home arbitrarily calls, or say arbitrarily, at the request of the decedent, calls Rogers or Strohmeyer's, whatever? Where does that fit into this mix?
Well, at this point, what's happened here recently has been that the funeral home has been contacted based on the request of the loved one upon their passing, and then what happens is when we deem that there's no family, or we deem that there's a reason why the county needs to step in, the county then brings that body into our care at that point. And so, there are fees associated when I'm not called initially. Funeral home's going to have a fee for a removal, those kind of things. But that's kind of out of our hands. It's not something that we can really get in the middle of too much. The two Home Lake cases, both of the individuals themselves had selected a funeral home, and that funeral home was notified at the time of death. The coroner's office isn't notified of nursing home deaths, hospital deaths if they're more than 24 hours. Those are things that are not reportable to a coroner's office. A nursing home death and a hospital death are not, unless they're less than 24 hours in either institution. They're not reported to the coroner by law, by statute.
So one thing the county could be on the hook for is that initial pickup of the body and transport to a funeral home, who then is going to provide for storage of that body until the coroner decides that they have to take custody of the body.
That's correct. Yes, John.
Is there any way to deal with that?
Let me think on that one a little bit. I don't know that I have a solid answer for you at this point.
You can put that in your report for the end of the week.
Okay, sounds great, John. I can do that.
Okay. So we had the motion and the second on that, I believe. Are there any other objections to having the coroner provide the basic transport as described by the coroner, which would include autopsies and things of that nature?
No.
Hearing none. Okay, thank you. The motion carries. Does that cover you?
I'm
Thank you very
covered.
much.
Thank you.
Thank you.
All right.
Okay. Open managers update. Do we have anything, Trish?
Not that I'm aware of, unless anyone other than Tony is in there with Jean. Tony's here for public health.
Okay. Then the next item is general business administrative items, and I requested that we move the disaster declaration up to that point for a vote by the commissioners. And this disaster declaration would be extended to September 16th, I believe.
That's correct.
Okay. Are there any questions on that declaration?
And do I remember correctly that we already voted on extending that and that all we're doing now is signing the resolution, or am I inaccurate?
Ryan,
I know there was discussion. My memory is not serving me well today on whether that vote actually took place. So unless somebody specifically remembers, my recommendation would be for there to be a vote on it today, just to be sure that that vote is in the record.
I think I agree with you, Ryan. Also, the vote would have been made without the language before us at that time. And I'm sure the language hasn't changed other than dates.
Correct.
But now we have the resolution before us, so we can vote to approve the resolution and get the signature on it.
Okay, I would move that we approve the resolution to extend the disaster declaration until September 16th. I guess that's all you needed.
We have a motion. Do we have a second?
Second.
We have a motion and a second. Is there any other discussion or objections? Hearing none, the motion carries. Okay, now we can move down to, is there other general business or administrative items? Yes, Trish.
I have one. So CTSI, with Dennis Hunt with CTSI has called in wanting to come in for a training. They wanted to discuss what works best for the commissioners. He was thinking within the next 2 weeks.
You want to come in for a what?
A training session?
Training. What type of training?
I believe it's for just general commissioner training. Well, if you remember, he was supposed to come at the end of last year and got delayed. Then COVID has delayed. He has finally reached back out and is ready to come back again.
And do you have the name of the individual that's doing that?
Dennis Hunt.
Oh, it is Dennis Hunt again. Okay.
Correct.
Would that be appropriate to do at our next work session, like Monday?
So that is the only work session that is free. And of course, it doesn't have to be a work session day either. He said his schedule is fairly open.
Ryan, point of procedure here, training session for the commissioners, would that be considered an open meeting?
not deciding any policy or carrying out any formal action. So I don't believe that would fall under the definition of an open meeting for the purpose of the open meeting law or notice.
Okay. So we wouldn't have to do this in a public work session nor a commissioners meeting.
I don't see why, and I can look into it further, but that to me doesn't make sense. And I think the purpose of the open meeting law is so that people are able to observe the policy and day-to-day decisions that are being made by their elected officials and boards. This doesn't fall into that criteria. So to me, that doesn't make a ton of sense. I'm going to say no unless you hear otherwise from me.
So could we pick a date that is or date and time exclusively for this training session, or we would not conduct any other business?
Yeah, that makes sense. And then also, I was just going to point out that if there's any desire for me to be present at the time a training occurs, this Monday's work session doesn't work at all because I have a very lengthy district court docket. So I just wanted to throw that out there as well.
I think we're going to have, we in fact might be a little bit busy in Monday's work session, Trish. We haven't discussed what may be before us, but I got a hunch there's going to be something.
Okay.
Can you, well, the other commissioners, you have thoughts? I'm thinking of having Trish coordinate a date. She can work with us and with Dennis Hunt and pick a date that does not have to be the same as a work session day or a commissioner meeting day, just a day for training.
Yeah, I'm fine with working on a different day if that's what it takes. I just would like to know ahead of time because I have July is pretty full the last 2 weeks of just odds and ends of meetings. So if Trish can get a hold of me and let me know, that'd be great with me. So
if you like, so that we're not, what I could do is just throw out a couple of dates in email between the four of us, see what sticks, and then contact Dennis. He said he was 100% open. I was going to save this for, I guess, the updates, but since we're talking schedule, just to let you know, we are going to have on the 27th our auditors work session, and on the 29th, they will be given the official report in that regular meeting. So that's where I had said that the 20th work session, if that was what was chosen, was during a work session, would be the appropriate one.
But that's this coming week.
Right. So he's available any day next week or the following.
Okay. If you could coordinate with the three commissioners for dates available and set that up. Did Mr. Hunt indicate how long this session would take?
He didn't. I believe the last one was about what, 3 hours? Does that sound right? When last time he was here?
I'm going to say it was the morning.
Yeah.
Okay. So we need to block out at least 3 hours. We may have more questions now that we've gone through kind of a stormy year. I know there's a lot of questions that I just have written down over the course of the last 18 months, things that I just wanted clarification on personally. So we'll block out like a 3 hour window, or
Okay.
if he has a recommendation for more time, whatever, we can incorporate that.
I'll confirm with him.
Okay. So it's understood that Trish will figure out the best date and time for this training session and set it up with Mr. Dennis Hunt.
Trish, is this an eyeball meeting?
Yes, I was actually a little bit surprised. He will be traveling down. And I think that's why they're finally allowing the travel, which is why he contacted.
So Mr. Hunt and I will be the two most vulnerable people in the room.
Okay.
That's fine with you, isn't it, Gene?
Yeah. I'm usually the old guy in the room anymore, so it's nice not to be that top dog this time. So.
All right. Anything else, Trish, under general business and administrative items?
I do not have anything.
Okay. Then we'll move on to public health business. Is Tony available?
I believe she's in the room.
And the way my screen displays, I see a little tiny strip up there at the very top of Jean's that I can't really tell who's in there.
Yeah, and as soon as Tony starts talking, it should split Jean's screen and show Tony.
Yes.
Yeah, maybe.
Okay.
I'm sorry. It's all right.
Under
Sorry.
public health business, the first item is approval of the minutes from the previous meetings. And those meetings are June 24th, July 1st, and July 8th. Are there any additions, corrections, or deletions to the minutes?
And I sent my corrections. And I would move that we approve them as corrected.
Okay, we have a motion to approve as corrected. Do we have a second?
Second.
We have a motion and a second. Any objections or corrections? Hearing none, motion carries. Okay, we've already done the disaster order. Tony, I guess we've got a series of contracts down here, and you had another one that wasn't on this list. Is that right?
Yes.
Okay, you want to just start and we can kind of deal with these one by one.
Awesome. So I've emailed all of the contracts to you guys since you weren't going to be here. You were probably already in your meeting, so you might need to check those if you wanted to look at the document. The one that I sent you yesterday is CARES Act funding that was specific for public health. We had already received about $20,000, and in order to use that money and receive the other about half of it, we'll need to have a signature on this document saying that we are able to use the funds, that we will use them appropriately. It's a pretty standard contract. And if we've already gone through it and you have any questions, I'm happy to try and figure that out.
Is there, I glanced at it, but I didn't get a chance to really read it, Tony. Are there is it fairly open-ended on what those funds can be used for, or are there specific restrictions?
It's going to be COVID related. So it's going to be within the public health department and COVID related. And there's also some partnerships that we could work on. Some of the things that stuck out immediately is we've had some pretty high cleaning fees. That kind of thing can be covered by these funds. And then staff time, which we've been looking for in just about all of our contracts, is how we cover the CARES response or the COVID response staff time. So those are covered in here as allowable. Some technology, some medical supplies. So some of the masks that we've been purchasing, that kind of thing, could be used in these funds.
Okay. So you would recommend that we approve this?
I do, yes.
Okay. Commissioners, do you have questions or comments?
Is this the same CARES Act money that's the big one we've been talking about, that's the 900,000, or is it a different
So the act, the release of these funds is in the same kind of group, but funds have been released to different sectors. So there's CARES Act funding that's specific for education and specific to local government, and this is the funding that's specific to public health.
Okay. Well, if it's your recommendation that we approve it, I think I would make that motion.
Okay, we have a motion to approve. Do we have a second?
Second.
So I would need, sorry, go ahead.
No, Tony, before we do, is there something else we need to add to that?
Really, it's just that this was meant to be turned in by today in order to accept those funds. So we'll either need to do an electronic signature, or if you're coming in to do signatures today.
I'm going to come in and do signatures because there's some other documents I have to sign. So I'll be in today to do that. Okay. So we have a motion. Do we have a second, Gene? I didn't hear.
Yes, second.
Okay. We have a motion and a second. Any objections? Motion carries. Okay, Tony, next. We're just going to kind of step through them like this if you need specific approvals on these things.
Perfect. So we have our agreement with our contractor, D. Kessler, who's doing the Regional Health Connector meetings. That's funded through CU. We don't have anything going above the contract on that, so we're not dipping into any public health funds or any county funds to pay for that. And that one is in the email that I sent you just here during the meeting.
Okay, I have a question on that one. It shows the county representative as Paul Wirtz.
I'll update that before John comes in.
Okay.
Okay, so with that correction, are there any other questions on it? I'm going to confess that I'm computer challenged while I'm on Zoom, so I haven't had a chance to really read the document and conduct the meeting at the same time.
Okay, I would also, I'm guessing we want a motion, separate motions on each of these?
I think that would be good for clarity.
Okay, I would move that we approve the, lost what it was called now. The
Regional Health
Connection?
Connector contract, which would be D. Kessler's contract.
Okay, that's my motion.
Okay, we have a motion. Do we have a second?
Second.
Okay, motion is second. Any objections? Motion carries.
Okay, then we have a STEP contract, which is the State Tobacco Education Prevention Program. And that is with Christy Hillis to be a contractor for us. She does a lot of our reporting and helps with that regional element of that contract. It's the same, actually exactly down to the dollar as it was last year. And that one again is Christy Hillis for STEP funding.
STEP means what?
State Tobacco Education Prevention Program.
Okay. Is this separate from the tobacco coordinator contract?
She is, I'm going to say no. This is the same contract. Christy Hillis, $14,600.
Well, on our agenda, we show a tobacco coordinator contract and then separately listed as subcontracts for STEP tobacco funding. Is that
Yeah,
two different?
she's the coordinator.
Okay, but under the subcontracts, are these other contracts with the counties that are listed on our agenda? And that needs to be, that's a separate approval?
Yeah, you could approve those four together if you're comfortable with that. But for this one, it would be best to do that separately.
This particular coordinator contract it's just kind of a standalone element for this whole program.
It is. Yes, and
Okay.
she's working directly with us here at the Rio Grande County Department and with the other partners. So I think that distinction is important, that she's connected to us and we're kind of overseeing her activities.
Thank you. So the issue is a tobacco coordinator contract with Christy.
Yes.
That's the first thing before us. Okay, commissioners, do you have comments, motions?
Okay, my question is, and I guess it's kind of about all of these different contracts, is COVID going to affect how they are run, or are there caveats within the grant that if COVID becomes an overarching problem where they can't complete the grant, is there a statement in there somewhere that says it's okay, or is that something where you would just go back later and get a waiver, or how does that even work?
Okay. So the contract agreements that we're doing, tobacco specifically hasn't adjusted or released any of their funds for COVID response. We're a relatively small tobacco region, so we're what they're calling foundational for our tobacco response. So we have very reasonable deliverables for our tobacco work. So I don't see those actually being fully interrupted. This year, there was no penalty. There was no objection to us not being able to fully spend down our funds. And the state has been really reasonable with that as well. They sent out a lot of requests and they've been communicating with us back and forth to see how we could use those funds and if we could still fit some things in, how tobacco response works with COVID. There's, especially considering the respiratory implications with the illness. Quitting smoking, reducing how much you're smoking, those kinds of things are an opportunity to do STEP while considering what COVID has done. So they're really thinking through it. I don't see any harm in signing the contracts, knowing that if we're not able to meet our deliverables, that's something that they were willing to work with us this year. So I would anticipate that they're still going to work with us through the next year.
Okay, thank you.
Gene, any questions from you?
No, I think this one's pretty well covered. It sounds like Tony's right on top of this, so I'm good with it.
Okay.
I would move that we approve the agreement for professional services within the STEP program.
And this is for the coordinator contract.
Yes.
Have a motion
Second.
and a second. Any objections? Motion carries. Do we want to deal with the subcontracts for the STEP program while we're on that tobacco subject?
So the subcontracts are for our regional partners. What happened with the application here for this program is that we did apply as a regional effort. That allowed us to do a bigger application and have more impact. So that was the goal. It's divided evenly among the 4 counties, the subrecipient part of this. You'll see in Alamosa's request that they have an additional amount for environmental health. So our environmental health team, which is another regional effort, they will take quick kits and they will help with messaging, and that additional amount is built into Alamosa as Alamosa is handling their contracts and pays them. So you'll see that that amount is higher than the other counties, but that's because of environmental health or actual tobacco work. It's the same across all 4 counties that we're subcontracting with: Alamosa, Saguache, Castilla, and Conejos.
Are we the fiscal agent on that then?
We are, yes.
Moving with the other commissioners, because I'm confused.
And for this, is it appropriate? I believe it's appropriate to do one motion to approve the whole contract with all of the other counties, and the remaining portion. Is that correct, Ryan? Or do we need to do a motion for each county separately?
No, I think a single motion would be fine, but my only caveat is that I haven't actually seen these contracts. And so I'm kind of operating on blind faith, but that sounds correct that you could do one contract in one motion. Sorry, you could do one motion for all the contracts.
Would you be more comfortable, Ryan, if you had a chance to review the contracts before we approve this?
I'm always more comfortable offering my advice on something I've seen. So yes.
And they're in your email whenever you are able to do that too. I'm sorry, it was just today that these went out.
What's the deadline on action on this?
It would be best to have these done before the end of the month. If we're gonna wait, there is another meeting we'll be getting together on the 22nd.
Tony, I do have a question, if you don't mind.
Yes.
So on that additional money that is unusual from previous years for the environmental group, and I know
That should be the same.
oh, I'm sorry, I
almost
thought you said it
exactly the
was
same.
different.
And this is funded through the tobacco grants, I assume.
Yes.
I would entertain a motion that we lay this aside until we get advice from our attorney, and then we take it up again at our meeting on the 22nd. Is that okay with you, Tony?
Yeah, absolutely.
Okay, Gene? I guess I'll need a motion on that to lay it aside.
I'll make that motion, John. We lay it aside till the 22nd.
Okay.
And I'll second that.
Okay, we have a motion and a second to lay the subcontracts for the STEP funding until the 22nd. Are there any other comments? If not, the motion carries to lay aside till 22nd. Okay, general discussion regarding COVID.
Let me step back because we did have on the agenda that we were gonna go over the Healthcare Coalition contractor contract.
Yes.
Oh, yeah, I skipped over that. I'm sorry. Yes.
That's okay. We had a discussion with her yesterday, and that coalition hasn't had an opportunity to get together to discuss their budget. And part of what they're going to be discussing is her compensation. So we'd like if we could come back with their recommendation on that before we bring the contract to you. And that meeting for the coalition is going to be later this week. So we should be able to have something in plenty of time to get it out for the 22nd. Mm-hmm.
Is this something we want to discuss in the work session? And then act on the 22nd?
I don't see a reason for a work session. Her contract, so this would be the contract for Cynthia Ford, who contracts with Rio Grande County as coordinator. We are fiscal agent of the HCC, so our contract is pretty standard and nothing different from years prior.
But they're talking about compensation changes. Is that correct, Tony?
Is that compensation for Cynthia or is that compensation for board members?
So we're going to be talking about the whole budget and all of the parts of it. And I'm not really sure where that's going to end up. I do know that we'll be discussing Cynthia's compensation specifically.
And this is on a contract, not an employee. Ryan, that can take place outside of executive session?
Yes, yes.
But this could, Tony, do you think this could be a lengthy conversation about the Healthcare Coalition in general?
I think it'll be a good part of kind of what we're talking about, reintroducing public health and trying to get you guys so you feel really comfortable with all of the different programs and grants that we're doing. The amount that they're going to recommend, we can make that adjustment on the contract, and you guys, that really does come down to whether you approve it or not. So the Healthcare Coalition coming together, they're building a plan that they're going to act advisory to bring that forward to you guys to approve or not approve. So that part of the planning is going to take a little bit of time. But yes, we'll need to discuss HCC just as we will all of the other programs. So I'm not sure where you want to put that on a priority level, but that would be up to you guys.
A time frame on making decisions on any of this?
The contractor, Cynthia's contract, it would be best if we have that by the end of the month as well.
Commissioners, do you think this has potential to be kind of a lengthy conversation, I would think? What do you think?
Yeah, I think it's something we probably need to take our time with and make sure we're doing what we're doing because, well, we know where we're at on the rest of that. I would just soon schedule some time where we can actually discuss it completely through and make a decision.
Would it be your recommendation we do this in a work session, Gene?
Yeah, I think so. I think I'd like to see this in a work session. Then we could, if we do that, if we could tie that to a work session, then we could put on for the next commissioner saying and still get us done before the end of the month.
Suzanne, are you comfortable with that?
It'd be fine.
Okay. So Trish, we would include this in a work session on Monday.
Okay, so our meeting is on Thursday, so we should have at least a basic idea of what the recommendation of the steering committee will be.
Yeah.
I'm sorry, you said something about Thursday. I missed part of that.
The budget meeting, the steering committee's budget meeting is on Thursday. So come Monday, we'll have a much clearer view of what changes, if any, they are going to be recommending.
Okay, so then we can set this for our work session on Monday, the 20th then.
Correct.
Mm-hmm.
Okay, thank you. Is that good for you, Tony?
Yep, that works.
Okay. General discussion then on COVID.
I can open it up with, we've got 5 active cases for our report this morning. and we're working on our contract tracing. One thing that will be part of a larger Board of Health discussion is how we're kind of shifting the staff. Ida would like to put more of her time toward contract tracing, and I think that's very appropriate, especially with her history as an LPN. She has a fairly good grasp of that kind of counseling, the process that Diane was explaining to us. So that's kind of our priority, is to make sure that we're putting our staff where they're most appropriate and making sure that we are responding appropriately to what we're doing, what we're facing right now, and making that plan for just in case of a surge or an outbreak, or being as ready as we can be before that comes.
Thank you. Tony, we haven't really discussed at length your role right now since you've stepped in to handle the administrative side. My impression, and perhaps my assumption, is that you'll be assigning the duties within your staff, within the public health department. Am I making the correct assumption there?
I think Trish and I had both, I came to her and said, how are we handling this? Who's doing what? And she said, that's a great question. Let's talk to the commissioners. And I think that's where we are, is that we would like to make sure that we're going forward with your direction, and we're not overstepping, and we're clear on who's being asked to do what. I think my hesitance to use the words interim director has probably caused a bit of confusion over the last few days, more than it has helped anybody. So
Confusion
with who's in charge of what, and yeah, so all the way from funders down to staff is really setting who's in charge of what. So I think our ask would be that you, as the Board of Health, make the call who should be doing what tasks, and how much of that should go back on administration, because I know we don't want to overwhelm Trish either, but she's always willing to do so much. So we're really looking to you guys to let us know what you think our direction should be. And Trish, please say if I'm misrepresenting.
No, and I think just specifically what Tony's referencing as an example is any applications that may be coming in for that nurse position that's out. And then, authorizing Tony to manage the employees. There was a big question yesterday when the applications came in. We weren't exactly sure. I think that Diane's opinion should be held, and should be given and respected, but I just don't think that she's that person to interview or work with human resources. She's also very busy herself, and she's very good at the contact tracing, and not sure she would have a level of comfort acting in that hiring role.
So Trish, if I'm hearing you correctly, you are referring specifically to hiring additional personnel, specifically a nurse right now. You have application, or plural. I don't know if you have more than one or not.
That's definitely one of them. Tony, I think, had a few others, but for this office, certainly that was the first thing that came up, is direction towards hiring. Of course, human resources is involved, but as we receive these applications, it would be my recommendation to have a combination of Tony, human resources, and myself.
Okay. And in your position as county administrator, that's separate from the Board of Health.
Correct. We're all just trying to help one another right now.
I see Ryan left the meeting. So as I see it, we have two issues before us. One is clear direction to Tony acting in an administrative function at the Public Health Department. She is temporarily assigned to that duty from the administrator's office at this point. And I don't know if she's looking for clarification on what we expect of her as the Board of Health functioning over there. So if she's asking for clarification there, I think we need to deal with that. And then as far as the hiring, which I assume is a fairly immediate event, the question is, who should be the ones that make that decision, the ultimate decision? And that could be the Board of Health acting on a recommendation from the people that interview, which would include Tony. In this case, Trish is suggesting that Trish be involved in that, and Human Resources. And then the Board of Health could ratify that decision or ratify that recommendation. I want to get clarity on the process here so we're not muddling. The only question I would have is, do you want to have a Board of Health member as part of that interviewing process?
I think if you start involving a board in that kind of process, that additional nurses are going to need the same thing. So that kind of sets, it doesn't fully set a precedent, but you get where I'm going.
Yes, I do.
All the same people in the interviewing process. The Board of Health right now hasn't assigned anyone to actually have the authority over, to have the responsibility in public health for our department. My ask would be that the board either go ahead and add the responsibilities and the authorities with an interim director, or clearly say no, and then we're going to have to seek out guidance on what steps we have to take or what that means just with the statute and fully staffing our department. So I think either you would need to go ahead and make it clear that we do have an interim director, or we're going to need to really spell out what that alternative looks like and make sure that that's acceptable.
John, I just like to say, I think for the clarity purposes for what I'm hearing in this conversation is, I think we need to probably take a look at going ahead and making or asking Lindsay to become our interim director. And that's
Lindsay?
Lindsay who?
I'm sorry. I apologize. I was reading the screen.
Lindsay, are you watching?
Tony, correct all the minutes
Thanks,
and don't
Gene.
shoot.
It's a lot of pressure, Lindsay.
Don't
You're up.
shoot me. Lindsay, are you still listening?
Yeah, I am. All of a sudden, I got a raise.
How'd you like that promotion? Oh no, it's not a raise. It's just a job.
Yeah.
Oh, well,
All the responsibility under the good.
So anyway, that's kind of where I'd like to see this thing go, and then we have some direction all the way around.
Clearly, we don't want a lot of ambiguity or uncertainty as to responsibilities. Absent any other changes or titles, I was kind of left with the impression that whenever we dispatched Tony down to public health to act as an administrator, that she would handle a lot of those normal administrative functions inside the public health, which could include hiring personnel as needed. And that if we need board approval on any of that, that she and Trish could bring their recommendation to the board if board action is required. Otherwise, we would grant her full authority to function in that role. I don't know if we name her as interim director, if we're going to have to go in for waivers on this.
I don't believe so.
And it may be one of those where it's easier to get forgiveness than permission later on. Trish, I saw you wave your hand.
Yeah, I think that definitely the hiring falls into that administration and could be argued that that does fit, but there are other circumstances, like we've been contacted about the schools. I believe you received one email. That is one that does not fall into administration, but more public health. They are wanting to meet with Rio Grande County Public Health. That's why they did email the Board of Health. They did call me and they called Tony. So I think a little direction on that aspect as well, that's not in any way administration, but public health business.
Mhm.
Well,
And some of the release of information and some of the partnership, some of those things, they are a bit hesitant to accept when I'm saying, well, it's a thing and I agreed to do some stuff. So.
okay, so is your recommendation, Tony, that we go ahead and give you the title of interim director along with all of the management and decision-making authority that goes along with it?
Yes, that would be my recommendation. I think it's also important to point out that we're not in any way cutting off administration or the upstairs here. I don't think anything's going to happen if we're not working with Trish and Danielle and having all of that support as well. So yes, and.
Okay, I would move that we change Tony's title or add to her title to include interim public health director. And along with that, give her the full authority to hire, fire, make recommendations, etc.
Have a motion?
Second.
We have a second. Discussion, and I do have some discussion on this. Personally, I think it's a prudent decision. That it adds clarity. I'm concerned about the time requirement because we're splitting time, and obviously we'd have to leave that to our county administrator as well as the public health officials, interim director, if that's whatever, to make sure that we have that it works well, that it works smoothly, whatever process we come up with. But you understand then, Tony, that as interim public health director, you're going to have to deal with Jasper.
I understand that we will have to continue to move forward however we can with that issue. Yeah.
Okay.
Like
Go
I
ahead.
said, I'm not taking on I'm not willing to take on some kind of superhuman or promise to be here 24 hours a day. But I think it is important, even in that case, that we continue to organize and move forward as well as we can.
Okay.
So yes,
And I would
something.
assume also that in some instances where we need official action on something, that the Board of Health can take that role based on your recommendations going forward.
Right.
And if we have to pick up part of that load, whatever that means, that you would tell us that this is where you need our involvement. Otherwise, we'd stay out of your way.
Okay. Well, we're going to be talking a lot, and I'm already talking to Trish all the time. She's
Okay.
tired of my face.
Make sure that the Board of Health is fully apprised of that. It gets into one of these clear lines of responsibility and communication on that. And we'll make sure we get the accurate information. So we have a motion, and Gene, you seconded that, I believe, didn't you?
Yes.
Okay, we have a motion and a second. And for clarification, I'm not quite sure how to say this, but what we're saying is we are naming Tony as the interim public health director, and that she has full authority to make hire and fire and duty allocation decisions within that department, and that she will coordinate with the county administrator and human resources as she conducts these efforts. Is that clearly stated enough?
I like it.
Okay.
I would also add that we are not changing her title, but merely adding that to her title as grants coordinator.
Yes, it's an additional duty. For pay purposes, she's working for the county administration office, basically, and then they'll work together to see how those funds are actually allocated between the public health fund and admin general fund. I don't want to muddy this up and make it more complicated than necessary, but I have confidence personally that that team is capable of handling this situation.
Mhm.
Okay, so we have a motion and a second. Is there any other discussion? If not, the motion carries. Congratulations. Don't come to us for a raise right away.
Not right away, John.
Okay.
I
Fair enough.
do. I would like to see if Monday we could add on, or we'll just have to wait till Wednesday. We do need to talk about the transition to the Protect Your Neighbor transition and what those steps actually look like. I'll send the guidance to you guys again to make sure that we're ready to have that conversation. It is complicated and it's going to take some time.
So we'll add that to Monday then? Is that give you enough time to do that?
If we have time, I don't know what your agenda looks like.
Right now, you've dominated it. So,
It was clear, so.
Sorry, guys.
okay. No, that's fine. It's a good time to do that.
Yeah,
So
if we could add that.
Monday gives you enough time to prepare for that?
Yeah, it's really going to be sitting down and we're going to need to pick apart the pieces and really explore how we can handle that locally and what we need to do to engage the region to get to a point where we can make that transition. So we're going to need to just pull apart all of the pieces of that.
Thank you. And along with that, I know Trish referenced the request from, I believe it's the Monte Vista School District on reopening.
We received requests from Sargent and Monte Vista so far.
We've gotten them from two of the school districts on reopening. I assume that the State Department of Education has some guidance on that the school should already be aware of, but I don't know that.
So they have guidance from June, from the end of June, so it's not too outdated. I believe new guidance is expected anytime now. And really our responsibility and the responsibility of Board of Health in making in working with the schools, we don't have a yes or no. We don't approve anything. What we do is use this expertise to interpret the guidance and make sure that we're giving the best advice we can after reviewing their plans and meeting with them. So we're not, the Board of Health isn't taking on the liability of saying, yes, a school can reopen or no, they can't. That's not appropriate for us. That's not what we do in this scenario. So it's really just working with them and the guidance and trying to offer some support and backup to their decisions.
Fair enough. So before we close this out, to make it clear in my mind, we are in the process of hiring an additional nurse.
Yes.
And Tony is also working within the department to use the term allocate the resources to best accomplish our mission and goal.
Yes.
Okay.
And is it just one nurse we're looking at hiring or two?
We've got one really good application. And I think we don't need to hold off on that very long. We need to really move forward and get people in there. But my ask previously had been that we look at hiring two nurses. I think it'll be important when we meet Wednesday next week. We're going to go over kind of the numbers and where all that comes from. And it looks like we'll have time to have that conversation about what funds we'd be using to bring on an additional nurse, another nurse, so that you guys can be clear on that before we move forward with bringing on that second new nurse.
The commissioners have approved two nurses. One would be Paul's previous position, and the other was approved, I believe, 2 weeks ago in a commissioners meeting to hire a new. So that would be two.
Okay.
And that authority is fully granted to the administration, interim director, et cetera. And I say admin, I mean Trish will be involved in that also, in that process. Is that clear? Or, I mean, you want to have the sole authority on that, Tony?
We're all going to work on it together. It doesn't.
Tony and I have interviewed together many a time. We're kind of used to it.
So you really don't need commissioner or board of health input in this process. You have the authority to, this part that falls within your realm of authorities.
Yeah, you'll have to have someone make the decision. So as far as clarity, we could do that. We just know I know that we're going to work together. I don't.
Okay, well, if you, back to your comment about you have to have somebody make the decision.
Mhm.
At this point, is it appropriate that we say that you with this team have that authority to make the decision?
It is to me, but that feels like a thing that it would be weird for me to answer.
Commissioners comfortable with that?
Yes.
Yes.
Okay. Tony, are you comfortable with that direction?
Yes.
Okay. I don't even think we need to vote on it at this point. It's just part of the job. That's
Yeah.
my, fair enough. Did you get what you needed out of this meeting? Do you have anything else for us?
I believe I've gotten what I need out of it. Our follow-up Monday will be really good for me. So,
One thing I would ask is that we make sure that when since we're making this appointment as interim public health director, that we check all the boxes in terms of making that legal, whether it's under waivers or whatever's required. But you bring us that. You guys can bring us that information. You and Trish can both bring us that information, or both, however you want to do it. But
I know Ryan spent a lot of time on that statute as well, so he might be able to help us out too.
So you'll coordinate with him also then.
Yeah.
And bring a recommendation. Great. Anything else on this topic? Hearing none. Suzanne, you got something?
No.
Okay.
Oh, Ryan's coming up.
Hearing none, I guess, Tony, you can go back to work.
All right, I'll do that.
Thank you.
Thank you, guys.
I won't read this from now on.
Thank you, Tony.
My bad.
Okay, unfinished business. Is there any?
We still need to put together the cooperative agreement for the CARES CVRF funding agreement. But I think my recollection is that there needed to be discussion as to what the county's role would be, whether we're going to be fiscal agent. I think that had generally been the concept that was discussed, but exactly what the terms of that agreement should look like. I also know that there were some reservations expressed about the county serving as fiscal agent, as well as what the role of the town of Center would be, given that they are only marginally within Rio Grande County and largely within Saguache County. So I don't know if we need to set a time now to advance that discussion, or if you're just wanting me to put together a draft agreement and then go from there and work out the terms accordingly.
If you could prepare the draft agreement, I don't know, how do we resolve the center issue?
I think you just resolve the center issue by having a discussion. They've already said and submitted their letter along with ours, basically saying that they're willing to let us be the fiscal agent. That certainly doesn't bind us to have responsibility for center's portion. I don't want to make an issue where an issue doesn't exist, but I knew that there had been some concerns expressed. And Suzanne, I don't want to call you out or anything, but I know that had been a particular concern of yours, or at least I thought it had been, given that they're only, I don't even know what it is, like 114 residents or something in the county. So if you want to speak to that, again, I don't want to make a non-issue into an issue, but I guess we'll go from there and see how to resolve that.
I guess what causes me concern is whenever we were having that discussion and Christy Doon from DOLA was on there, is she expressed concern about overlap of authority or overlap of whatever might be considered, and that she said that they would need to be extremely clear and extremely cautious if they were to be involved with two different counties. And that's where my concern comes in, is we don't do a lot of stuff with Center. And so we don't know how they handle their financial stuff. And I don't want us to end up in a situation because they did something inappropriate.
I think the Center question, when they brought their stuff to the meeting that day, they were very specific at how they engineered the dollar amount they were asking for the Rio Grande County side of it, based on the population times whatever that factor was. I don't remember the exact numbers. Would have to get them again, but I know Brian was pretty well set that that's all there would be for Center Rio Grande. So Watch was going to pick up the balance. So I don't know. We'd have to get those numbers again, Suzanne, to see what they were. I can't remember exactly what they were, but he was pretty specific with what he was asking for in that request. So.
Well, and I recognize that, and he probably had a better request than what some of the other municipalities did. And so from that standpoint, I don't really have a problem with it, but it was rather concerning to me whenever Christy was very concerned about it.
Yeah.
And so I think it is going to require additional, for lack of a better word, supervision on that portion of the grant. I'm not saying it's a bad thing. I just think it's going to require some extreme caution to make sure that we're not in putting ourselves in a bad position.
Okay, so I guess what I can do is put together a draft agreement, and then as it pertains to the town of Center, build in their language that makes it crystal clear that they can't duplicate efforts in requesting reimbursement or double dip, for lack of a better term. And then also we had talked about making it very clear that even if we serve as the fiscal agent, there would ultimate responsibility for ensuring that the costs were appropriately allocated to the municipalities for the purposes intended by the CVRF funding, and that the county basically would be indemnified or repaid by the municipality for any reimbursed expenditures that shouldn't have been. And so I'll work on that language and work with Brian to make sure that we've got, and I think it's Mike Trujillo, who's the Center town attorney, and make sure that we've got that language in there so that if nothing else, you feel comfortable with what our role will be.
Okay, Ryan, if even if there's that language in there that says that if they do something inappropriate that we aren't liable and they would have to pay it back, what is the process for making them pay it back? Is that something where you're going to have to go to extreme measures in order to get it back, or?
That depends on their level of cooperation in repaying that. I would hope that given our relationship with the town of Center that it wouldn't require litigation, but I think you keep all avenues open up to and including. But I think we'll work under the assumption that it'll continue to be a cooperative agreement. And since they signed it, and assuming they're going to sign this agreement, they're going to make good on their end of the bargain. But yeah, certainly there would be recourse for the county, and you'd keep all avenues open for seeking that reimbursement.
And I guess maybe my question isn't just about the town of Center, but with any of the municipalities.
That's true. Yeah, that's true.
Gene, do you have any thoughts or concerns on this?
I'm not concerned so much with the handling of it. I think if we get this spelled out right in our contract that Ryan's going to put together, I think we'll be all right with it. I know there's always a chance of everything we do, but at some point we got to get this money in and get it distributed to where it can do the good that it was intended for. So I think we need to kind of take steps moving in that direction.
Okay. One concern that I have, maybe you all have the answer. I'm unclear as to what exactly are eligible portions of the CVRF money. It's my understanding that that money potentially can be used for direct grants or aid to local businesses. I would like clarification on that, because once people figure that out, there's a chance that there'll be a mad rush for the money. And I'm not quite sure how we best approach that, but I would like to see us have a clear understanding of what eligible activities are under this funding program.
We can definitely discuss that possibly on Monday as well. The federal law states that it has to be in response of COVID and in mitigation of COVID, and the term they use is business loans, but we can definitely explore that further.
Okay. I know that many of the businesses throughout the county, primarily in municipalities, have taken advantage, and I don't mean that in a negative way, but they've been able to take advantage of COVID-related funding specifically for business assistance, whether it was the payroll protection program or some of it is direct loans and or grants to businesses to help them survive. It would be good to have real strong clarity on what we can and can't do with that, and then come up with some sort of a plan going forward if we're going to set aside a portion of those funds for that purpose. And then that opens it up to a whole bunch of negotiations with the different cities, I'm sure. I'm not familiar with what is happening within Del Norte nor South Fork, but I know in Monty there's the potential to have several requests for assistance. So I just want to make sure that we know what we can't do with those monies.
I agree. I guess my request would be that if I don't see it on Monday's work session agenda, if this is to be added for Monday's work session agenda, because I have a district court docket, if Trish or somebody can take detailed notes about what the county's requests are or positions are with respect to some of these issues, so that I can incorporate those points or concerns or whatever they are into our agreement. If there's some way of communicating that information to me, that would be very helpful.
Would it,
You're in a position to do that, Trish?
Yes, we could definitely take notes, and I also do usually record those sessions as well if that's easier, if something's not clear in my notes.
Okay.
would it be better to have that discussion at a different time when you can be there? In case you have additional questions for us?
It would be great if I could participate. I understand that the 2 Mondays that I have dockets always conflict with work sessions, so I apologize for that unavoidable conflict on my part. But I don't know if we already have something set for the 27th.
So the 27th, the auditors are coming to do a work session, and then they are reporting the audit results on that Wednesday. So we'll have at least a few hours with the auditor on the 27th.
I think there's probably more harm in unnecessarily delaying that conversation than there is in me not being able to personally participate. As long as I can get some notes or even review the record, that would be helpful. So thank you for that offer, though. I just don't want to push this off a whole lot longer, since I know we're likely in need of that reimbursement, and so are the towns.
So, Trish, can we add that to Monday's work session? And it'll be probably information, maybe expressing concerns, but right now, maybe information on that whole program and what the eligible expenses are.
It's done.
Done? Okay, go to that Monday. And Ryan will maintain close contact with you. Make sure that you get what you need on
At
that.
least 6 feet away, John. That's all I'm requesting.
I'm about 3 feet right now, 2 feet right now.
Thanks for
Okay.
that clarification.
Unfinished business, I have another item, and that's Summitville. Trish, I had notarized the Second Amendment. I got a call from Mark Rudolph, and he had not seen that yet. Has that been forwarded up?
It has been, so I can follow up on
I think
that.
it's going to require follow-up. He was going to check on it. That goes to the Attorney General's office and then back down to us for recording.
Gotcha.
Okay?
Yeah, I'll follow up on it. It was mailed.
Okay, so as long as it was sent out, that's all.
And do you mind forwarding a copy of that to me so I have that with my Summitville information, please?
I sure can.
Thank you.
Is there any other unfinished business?
How is the Tyler conversion going?
Exhausting. So they do require 8 hours a day. We have been trying to, between the 4 of us here in this office, split time duties depending on what each of us are doing. So the 8 hours a day is for the intense, full-fledged integration. We also have a number of Tyler trainings at 3.5 hours a pop that we are all conducting as well. So it's been a little bit of a juggling act, but we are getting there. We are slightly behind just due to all of us actually needing to do real work as well. Very slightly behind. So we are currently, it's been a discussion this morning, actually. That was a great time to ask because we're in the process of canceling some of the training so we can get the implementation caught up.
Do we have a
Go ahead, I'm sorry.
do we have a time frame for when that's gonna?
So we're scheduled to be live in September. We will be running both systems for August payroll. And full-fledged live is expected for September. So we're at the last end for sure.
Good. Wonderful. Thank you.
No problem.
Very good. And Trish, is there anybody in our office that's going to be totally familiar with Tyler, to be our Tyler expert?
We are all spending 8 hours a day split between all of us, depending on our own duties. So at this time, those trainings aren't necessarily according to our job titles. So we all will be familiar with all aspects by the end.
Okay, so all of you will be familiar with the general operation of the Tyler system then.
Correct.
Okay. I have another question for you, Trish. Are we still having those daily COVID DOC meetings? Or not daily, but the 3 times weekly?
So there was an issue once Paul left. It seems as though Nancy was on a different call. So every time that we logged in, it kept saying that the host is in a different meeting. So they did have one today. I was unable to join. I had a meeting with our auditors, Cindy, with the clerk's office and the treasurer and Debbie. So I was unable to join that one, but Art joined it here and then caught me up. So they will be continuing. Now, we did discuss on Friday, we probably will have one at a different time, being that the SLB commissioners will have a meeting on Friday, and both Art and Tony will be joining.
Okay, so we for Monday and today, we don't have any information about those meetings.
I can have Art maybe type up something. Art did attend while I was in that audit meeting with the treasurer and the clerk.
Okay, that was today or Monday?
That was today. Mondays, everyone was unable to join due to, I guess, Nancy being in a different meeting. None of us were able to join.
Okay. Probably ought to get some clarity on that if we're going to continue these meetings. And if you're not available to transcribe them, at least have somebody that can get us the information.
This was a last minute meeting, so I was unable to organize that, but Art was in here and on it. So I'll see if he can give a little bit of an update and write it down for us.
Okay, thank you. Is there any other unfinished business? If there is none, we'll go on to the commissioners and administrator updates, the financial update.
So I believe you guys should have seen the financial report. Going over it generally, I mean, everyone's doing a really good job. I think that most of, if not all of our departments are being very conscientious about what they are spending money on. So just to give a general idea, we have our general fund who has received let me back up, sorry. This is through May. With that delay in the two systems, we are currently at May. So as of May, we have received 46% of our revenues, which is just barely under exactly where it should be. And we have only our expenditures are at 34% for the general. We've actually, up to this May, increased the fund balance by $346,912. Our road and bridge fund has received 34% of their revenues and spent 27%. Again, that is at an increase of fund balance. Our weed district at 37% as of May and 15% expenditures, which is again an increase to fund balance. We have our airport fund who has received, that's the one that I kind of want to take just a little look at because they've only received 27% of their revenues. I'm not too concerned over it at this point, but I probably will be having a conversation with Jay. Their expenditures are at 34%. I'm going to skip by sorry.
A question on the airport fund is where they haven't received a lot of their revenues is under intergovernmental revenue.
Correct.
Is that the PILT that we were talking about last time that
that is almost 100% of that.
Okay.
Yep. So outside of an additional $1,000. So every year you have approved a PILT transfer of $25,000. So as you see, it's budgeted for 26, so that is nearly 100%. And they have already received 1,200, which is not.
Trish, I don't want to get us off track here, but while we're on the airport,
yes,
a couple of things. One is they're holding their scheduled meetings erratically.
They are.
And so, for instance, on our calendar, it still showed. I called Tom Hapley yesterday morning and asked him, "Are we having a meeting?" The answer was no. Now, I assume that they should let you know if they're not going to have a meeting, and then
they
you can
should
adjust the calendar accordingly. And secondly, I asked about the fog seal, which is a major project. It's a huge project that we're going to have to contribute 20-some thousand to, I believe. He had no information on that at all. And again, that should be coming directly to you from our airport manager.
Correct.
And he should keep you updated on that. Thirdly, we have the potential for one or more mini grants for the airport. We're halfway through the season, and from what I can tell, the manager has not come forward to you with any kind of request or recommendation. Is that correct?
Yes, I did speak to him though on July 10th, that would be last Friday, about the fog seal and the grant. He did express that he would need some help with that grant. Of course, I did offer to help, and we're supposed to be getting together when we're both available to discuss both subjects.
Okay, when available, do you have any idea when that could be? Because this thing keeps sliding. I think I know of 2 meetings that he was scheduled, or reports he was scheduled to give us, and he was unable to do it. And
correct. And that was for the contractors that he was trying to bid out for, or consultants, sorry.
We have questions of the manager, and I would assume that he should be able to make time to meet with the commissioners to talk about this stuff.
Mm-hmm.
How do we make that happen?
So if you would rather it be a conversation with the commissioners, I can let him know instead of organizing that meeting with myself, we can organize it with the commissioners,
Well,
perhaps in another work
I
session.
don't think it's one or the other. I think it's probably both.
Okay.
But the clock's going to run out on us on this, and we don't even know. I don't think anybody on this board nor you can tell me if the fog seal is scheduled for this year or next year with CDOT, and that should be a fairly clear answer. And Tom Hafley expressed concern to me that while we were told the funding is available for that fog seal, that CDOT is starting to cut back on programs. And I think if we need this fog seal done, and the manager was pretty adamant that this needs to be done, we should have clear answers from them, from him specifically, on what is going on. Otherwise, I'm afraid we'll find ourselves like we did with the mini grant last year, where we had relied on that individual to get the job done, and his terms were, my bad, didn't happen. And I think that would be a mistake to let that happen again. But I don't want to load you down with any more. I mean, clearly, I mean, you're going to be busy, but somehow we have to get this done. Even if it's just simply you tell him to come in and talk to you, or come in and talk to one of us, or whatever, but he's got to come in and tell us what's going on.
So that was the discussion that I had last Friday, is for him to come in and talk with me. So I can reach out again and make him pinpoint a time where he is available for that, and get that discussion at least started.
If you could
He
do
did
that,
say
then
he
you
was
can,
working on the fog seal, as if he was actively working on it.
and you can get back to us then and just tell us what happened, and then we can decide from there. But he needs to show up and give a report to the commissioners under the managers section or something.
Okay.
Going forward. That's my opinion. I don't know. That's just John. But I can see this falling through the cracks very easily.
So if the commissioners would like, what I could do is go ahead and schedule him at the next meeting for an update, and hope that he's available for that, and let you know if he says it needs to be rescheduled. But I can go ahead and schedule it for the 22nd.
The 22nd, which is a work session.
No, that was a special meeting.
The 20. Okay, 22nd. I'm having trouble reading my calendar in the dark over here. Okay, is that okay with the commissioners that we do that?
I think that would be fine.
Okay.
And
Jean?
according to my understanding, the fog seal is scheduled for September.
Well, that's what Tom thought, but he didn't know. And so that's the reason for the question.
That's just my understanding, and I don't know that that's official.
Okay.
But
Well, we can get those answers if the manager will show up for a meeting. Okay. Let's see here. I've got to split back. We interrupted your financial update, Trish. I'm sorry.
Yes, I wasn't quite done. So after the airport, I am going to go ahead and skip the Conservation Trust, because that's not something where there's department heads and necessarily budgets. Our tourism, of course, is just due to COVID, a little bit of funds that have gone down. They are at 34%, which isn't as bad as you would think with the circumstances, and they've only spent 11%. I do expect that to change in 2 months, because we did go a little bit of delay on their expenditures. The Public Health Agency visually looks the worst. However, I would like to remind you that until Tony was on board, nothing was invoiced, so zero revenue was even asked to come in for the grants from January through May.
That was the public health director that had not submitted those requests or provided
Had not approved the invoices to be submitted, correct?
Okay, but that has been rectified.
Has. So I am expecting, so since this is through May, within the next 2 months, we've already seen a couple of those checks filter in. We should be seeing them completely, I would say, by the end of this month, as long as CDPHE is, on their usual 1 to 2 month, they receive our payments. So they are at 21% revenue, and their expenditures as of May are 32%. The only one that has a negative would be that public health, that, as of now, May, they have used 87,236 of their fund balance. But again, that is because invoices were not submitted to receive the revenue.
Okay, thank you. That's take care. What else you have?
I will have for the next meeting our updated sales tax, users, lodging. I did not have enough time, given all circumstances, to plug that into our charts. So I will be presenting that next Wednesday.
Okay.
But we do have those numbers, and just to give everyone a heads up, the sales is still on the upward, ironically.
Well, everybody's shopping online. We're getting our taxes.
Apocalyptic shopping. I just do love that term.
What do you call it?
Apocalyptic shopping.
Oh, yes. Good. We got a lot of sales tax on toilet paper. Okay. You have anything else for us, Trish?
I do not.
Does the commissioners have a question?
No.
Nope.
No.
Nope. Okay. Is there anything else under commissioners or administrators updates?
I have nothing.
No.
Well, Gene, tell us about the tourism board. How's that working?
Actually, I was very impressed. The people we have on that board now actually ask questions and have a desire to drive tourism for Rio Grande County. I think Trish sat in on that meeting too, and we saw something we hadn't seen before, and that's where you actually had a discussion between the board members about things that were going on, wanted to know the answers to, and I'm really excited about what the tourism board is going to turn into.
That's good news. Speaking of tourism board, we know that Southwick is trying to get a item on the ballot for forming a marketing district, and I saw an email from Cindy that the map they provided was not distinctive enough for her to determine where the voting boundaries are going to be on that. I'm presuming that Cindy is working with South Fork on getting that clarified. Have you heard
Yes.
anything?
That's last I heard. She was working with Rick Morgan? Yeah.
Okay.
With South Fork to try to rectify some of that. So.
And
Okay.
I met with Cindy yesterday about that subject, and yeah, they just kind of gave an aerial map instead of showing like from the assessor with the actual land, and their description did not even match what the map had said. So she will be requiring a different map from them before moving forward. Mr. Morgan has requested to be on the agenda on the 29th.
So they're going to have to do something besides use a color crayon to mark their boundaries then, I assume.
Correct.
Okay. So Suzanne, I guess you said you didn't have any updates?
No.
Okay. I have no updates other than my comment about the Summit bill. Railroad, apparently there's a lot of stuff taking place at the bankruptcy court. I'm not quite sure all of that. And Ryan, you gave us an update on your conversation with Pete Schenken, I believe. Have you heard anything new?
No, I do need to, this week has just been so chaotic. I haven't followed up with anybody on that side of things, but I do need to follow up and let them know, what the commissioners voted on last week. I am still waiting on a revised copy of the motion from Mike Panko. In the motion, that the draft motion, there was a typo where defined the county as unsecured creditors. Mike said he was going to fix that. So I need to follow up and see where we are in those corrections. And then I also wanted to follow up with Alamos County and find out what, if any, action their board took last week. I haven't seen any pleadings or filings or anything else come through from the bankruptcy court. So in terms of developments, I don't have any updates there. But when I get a chance, I'll follow up with Pete or Mike and see where we are, A, on those changes, and B, in the bankruptcy proceedings.
Okay, just for your information, Big Shoulders has filed some complaints about the trustee. a fairly lengthy list of complaints. I have no idea where they're, and there've been some other responses. So there's, I don't personally pay to get copies of all of those motions. It cost me about $4 a pop to get those. But I've seen that there's stuff being filed and kind of a dispute with Big Shoulders and the trustee right now. I don't know what if anything that means to us.
I can check with Sherry, the treasurer, and see if we've received any mailings. That is because her address is what is listed on our bankruptcy claim. They tend to send notices to her. And so I'll see what, if anything, she's received. She's been very good when she gets something about forwarding to me, and I haven't received anything from her. But there's no harm in following up and seeing if perhaps they did send something her way.
Right. I suspect that she's not being copied on all these motions is because of fist fight between different parties.
Yeah.
And Panko would be the one that should be on top of that, I would think.
Yeah.
Okay. I have nothing else on this. Does anybody else have anything under this section? None. Do we have a need for an executive session?
I do not.
I have not been made aware of any, no.
Okay. Then that takes us to the end of the agenda, as I understand. There's other business on here. I think we covered everything that would be other business. Okay. If we're done, I'll take a motion to adjourn.
I would make that motion.
Second.
A motion and a second. Hearing no objections, the meeting is adjourned 12:22 p.m.
Have a good day, everyone.
Thank you.
Thank
Thank you, Phil.
Where at?
Right across, almost across from the Pizza Hut over there. There used to be a recruiting officer.